cancer, and it's one of the most commonly diagnosed cancers in the United States, but thankfully there have been so many advances in the treatment, and that's what we're about to talk about right now. Radiation oncologist Christopher J. Rose is with us from Shelby Baptist Medical Center, and we were talking about this awesome technology that has been developed that's happening right here in our area. So we appreciate you being here, first and foremost.
So much.
Obviously, cancer not exciting to talk about, but this technology to fight it is really exciting.
It really is. We're excited. So as we were discussing, for small skin cancers, of course, they can just be cut out or removed or that sort of thing. But when they're in areas that are sensitive from the standpoint of cosmesis, how a person will look afterwards, you know, we don't want to do extensive surgery, or there are times when it may be too deep to get out with surgery alone, and then we turn to radiation therapy.
So
and that's what I specialize in.
You were showing me these models. I just want to make sure we get to these.
Sure.
These, and so tell me what this is and how it will work in the treatment.
So first of all, if I may, what we are really excited to be doing is that we have a system made by a company called Dot Decimal, and we are one of 4 centers working with them to further develop and test this technology, where we can use a simple iPad with a camera connected to it that does 3D surface imaging to rotate around the patient and take an image of their face or whatever part of the body is affected, and then design treatment devices to target just that area.
That is so cool.
And so we're also using some of Decimal's other products, like this one here, which I think I showed you, which is pretty exciting. This is a brass mask that is custom made for an individual patient. So this patient, as you may be able to tell, had a skin cancer of the nose, so that would fit over the nose, and then over here we have an area where it's cut out that allows the radiation to penetrate just ideally, and this was custom milled to fit the individual patient, nothing that we pull off the shelf.
That is so cool. And you said some of these molds you can have ordered in no time.
Yeah, we can. So our basic beam shaping equipment that we are able to get with the Decimal 3D system is overnighted to us.
Wow.
So even with a little bit of testing and quality assurance procedures, we're able to get a patient on treatment within a few days at most.
I was telling you commercial break, I really enjoyed talking about medical procedures, but for people who are at home, talk about how much of a game changer this is if they're not really interested or this doesn't seem like it's that big of a deal to them.
You know, the big deal is that this is something that really improves the quality of the surface anatomy that we can get. Again, in the case of like a nasal cancer, on the side of the nose, that is, it's very hard to envision exactly how the surface of the skin looks on a CT model, let's say, which is what we would usually use. And so here we're able to actually 3-dimensionally model that patient's skin surface and identify it so quickly. And just the efficiency of the process is really the big game changer, so that we can get patients from diagnosis to treatment in a much shorter time with greater precision and altogether better outcome, God willing.
This is cool to me. This is really cool, and like we said, a game changer in the cancer fight, which of course it's always an ongoing battle. So we appreciate you sharing that with us. Please contact his office if you have any more questions about this. I probably will, because it's interesting.
Patients can always go to our website at www.genxrt.com to learn more about this and the other services we offer at Shelby Baptist.
Thank you so much for coming in and sharing that with us. We
My
appreciate
pleasure.
it, and thank you. All right, guys, well, coming up.